blue death, and cholera Sicca. You must be familiar with blue death. I'm not sure you've known much about cholera Sicca. Well, let's go. Yes, the definition of the blue death you're familiar with is likely going to be that it is known to be associated with vomiting and diarrhea. That is when it is obvious, right? And that will be leading to profound dehydration, and organ failure will follow, and cyanosis, and death will occur within hours if not treated immediately. But today, we're dealing with another entity called cholera Sicca. In this case, you're not going to find obvious vomiting and diarrhea, yet it is cholera. But what will happen? Let's see. Yes, what you've known is true, but there's another condition associated with cholera that you are not going to find obvious vomiting and diarrhea. This is an uncommon type of cholera. Here, the fluid will be accumulating in the intestinal lumen, leading to hypotension and organ failure. There will be no external sign of cholera, meaning no diarrhea, no vomiting. And mortality is pretty high as half of all affected people can die within a few hours. What are the possible clinical features? No vomiting, no diarrhea, that is obvious. And it is still cholera. Fluid is sequestered in the small and large intestine. But you will notice that the abdomen is distending, so abdominal distension with signs of hypovolemia. And the signs will be sunken eyes, sunken fontanelle, dry lips and tongues, skin turgor, low blood pressure, cyanosis, the heart rate will be rising, low urine output, weakness and dizziness will set in. Pneumonia is possible in children. Glucose level may drop, hence we'll be dealing with hypoglycemia, and we can run into coma and death. These are the signs of hypovolemia, but there's nothing obvious outside. No vomiting, no diarrhea, yet it is cholera. Yes, blue death can still occur even without obvious vomiting and diarrhea. It's a different form of cholera. It is as deadly as the well-known type of cholera. So, the abdomen will be distending. Signs of hypovolemia will be obvious. Mortality is pretty high. The skin will turn bluish gray. Cyanosis, and that will be secondary to severe fluid and electrolyte loss. Mortality remains very high. Thanks for listening. Cholera may not present in the typical way. Be suspicious. In cholera outbreak, the tummy of the patient is distending, signs of hypovolemia, then it's likely going to be cholera Sicca. Remember to subscribe to my channel. I appreciate it.